It can be difficult to view Australia, and in particular populated areas of Australia, as disadvantaged. However, to be disadvantaged or marginalised is in essence an exclusion and deprivation as a result of a person's own behaviour or otherwise. As I will address through this presentation, there are countless ways in which a person, family, or group can be led to a situation of disadvantage. What is critical to remember is that disadvantage can be a fluid state, and through a concise, well thought out approach, it is possible to assist people to return to a more secure position in society. Unlike disadvantage, marginalisation tends to be forced upon a person or group, incidental or otherwise. It can commonly be a result of cultural diversity or a limited ability or confidence to communicate effectively, and this can unfortunately result in becoming a peripheral part of society. Education in Australia has the ability to be broken down into an array of demographics and categories. It has the unique ability to cover areas ranging from early childhood to mature age, rural and remote to inner city, in addition to Indigenous and non-Indigenous. These categories all intersect in a range of areas, adding to an incredibly complex education system, attempting to cater for a diverse nation with constantly changing priorities. When focusing on the topic of disadvantage and marginalisation within education, low socioeconomic families cover a vast range of situations and needs. As previously mentioned, disadvantage can be a fluid state, and this is highlighted through families where someone may be significantly disabled, suffering from mental health issues or domestic violence, which can have strong flow-on effects. Migrant families can also inadvertently be affected due to unrecognised qualifications or an initial difficulty with English as a second language. When these shifts in the family dynamic occur over long or extended periods of time, it changes their priorities. The priority is redirected from education to potentially employment, health services, or a search for adequate housing, and this can have a significant impact on long-term educational habits. Research shows that currently 17% of children within Australia are living in poverty. It's more than 730,000 children. Whilst a shocking statistic, it is important to look at what defines poverty and the different levels of poverty a person can be experiencing. Absolute poverty is defined as the absence of what is considered to be essential living requirements over an extended period of time. These essentials include adequate healthy food, clean drinking water, access to sanitation facilities, healthcare, whether that be for general ailments or specific medical needs, reliable, consistent shelter, and free education. For some of these things, such as education, it can be the absence of affordable or accessible transport that inhibits someone's ability to attend school. Relative poverty is outlined by social institutions and expectations, and as a result is subject to change over time. This is most commonly affected when a household's income is a certain percentage below the median income of a country. In this generation, for example, a family's inability to afford to participate in community sporting activities or have Wi-Fi and a computer in the home could be indicators of relative poverty. Outlined by the ACOS 2016 report into poverty in Australia is the poverty rate within a variety of family types. Over the decade, lone parents have had a consistently higher prevalence of poverty compared to all other family types, with a third of lone parent families living below the poverty line in 2013-14. Single people with and without children generally experience a higher rate of poverty than couples. The poverty rates in 2013-14 were 33.2% with children and 24.6% without children for singles, compared to couples at 11.3% and 10.1% respectively. This is because single adult households have only a single income, but still have the fixed costs of running a household with or without children. When looking at ABS data, we find that while the annual number of marriages in Australia has remained relatively steady over the last decade, the number of divorces has seen a slight decline. The ABS also states that the median age of couples marrying for the first time has slowly risen over the last 2 decades, with marriages lasting slightly longer. Recent census data shows that of Australians aged 15 and over, 48.1% were married and 11.7% were either divorced or separated. The New South Wales Council of Social Services Anti-Poverty Week statement in 2014 identified 14.6% of the total population to be living in poverty, and a further 7% are at risk. Within that, an astounding 40.6% of children in lone parent households are considered to be living in poverty. This places children in single parent households as 3 times more likely to be living in poverty compared to couple households. The Smith family has conducted extensive research over many years, with a focus on assisting disadvantaged children within Australian education. The Smith family has found that disadvantaged students are on average 2 to 3 years behind in reading and maths by the time they are 15 years old. 14.5% of Year 9 students whose parents' highest level of education was Year 11 or below did not meet the NAPLAN minimum reading requirements. The reading gap between the lowest socioeconomic status students and the highest SES students is equivalent to almost 3 years of schooling, and there is a 20% difference in the proportion of young people from low socioeconomic backgrounds and those from high socioeconomic backgrounds who attain their Year 12 or equivalent. University students from high SES backgrounds are also 3 times more likely to attend than students from low SES backgrounds. That last statistic strongly reiterates the point made earlier, in that disadvantaged or marginalised students are unable to make school attendance or study a significant priority. What are the long-term effects of this? The Smith family research introduces us to the cycle of disadvantage, whereby children in low-income families, suffering from a range of disadvantages, start behind in school from an early age. Without access to sufficient resources or positive role models, they struggle with motivation in developing goals and successfully completing their studies. This lack of engagement then has a flow-on effect to the workforce with limited opportunities, and as a result, long-term life outcomes are restricted. As the cycle suggests, these habits can then be passed on to the next generation. The next diagram, as presented by Rishi Desai of the Khan Academy, shows the idea of social exclusion on its own is infinitely complicated, just as Australian education as a whole. If the centre of the circle is viewed to represent education, we can see how various aspects of disadvantage and marginalisation can easily pull the focus away from learning crucial skills. Then take into account that groups or individuals will rarely be challenged by only one factor, and an appreciation for the difficulty in providing the correct services to aid a situation becomes prevalent. It is essential for government and community institutions to work in conjunction with schools to ensure individual needs are best addressed and education can continue to be viewed as essential to Australia furthering itself as a nation. The Smith family strongly believes in early and consistent intervention throughout a student's schooling in order to best provide long-term results and discourage the effects of social reproduction. Various government agencies have put in place strategies in order to outline ways for the wider community and various institutions to communicate effectively on the ways of best practice to assist struggling students. Just last year, the government announced $73 million was to be used to support the mental health of Australian children through the National Support for Child and Youth Mental Health Program. The focus is providing consistent training and resources on mental health issues to people who regularly interact with school children of all ages. Now, this includes teachers, school communities, doctors, nurses, and other healthcare professionals. Research carried out by the Organisation for Economic Cooperation and Development into international levels of education have come to show the percentage of 25 to 64-year-olds that have completed education below upper secondary level, upper secondary or tertiary levels. Whilst highlighting Australia's strong education system, it did make clear that money spent has not improved results. This further support in the Smith family model that it is crucial for money to be invested into programs that target specific needs early and offer ongoing support in order to ensure positive long-term results.